I am Dr. Harish Gowda, consultant, laparoscopic surgeon and surgical gastroenterologist. I am the founder and director of HIMAS. I am going to explain about the obesity. When we call a person is obese, we consider patient weight, height. We calculate body mass index. Based on the body mass index, we classify the patient is overweight, pre-obesity and obesity. If the patient has BMI less than 25, that is 18 to 25, that is called overweight. If the BMI of the patient is 25 to 30, it is called pre-obesity. So 30 BMI, it is called obesity, and obesity again we classify the grade 1, grade 2, grade 3 obesity. Today, obesity is one of the epidemiological disease. It is rampant everywhere. So obesity is also called as syndrome X, that is, it includes diabetes, hypertension and dyslipidemia. So why we need to treat the obesity? So obesity has so many risk factors, like the patient is more prone to get the diabetes, hypertension, dyslipidemia, arthritis, and the obese patients are having a high risk for malignancy of the colon, malignancy of the breast. That's why we need to treat the obesity as a disease. So what are the different modes of treatment of obesity? So usually we advise lifestyle changes. What are the lifestyle changes we advise? It is diet and exercise. Diet is the most important aspect of management of obesity. So we have to calculate the total calorie requirement for a patient in a day depends on his type of activities. Whether the person is very active and doing a regular activities, or the patient is sedentary lifestyle. Based on that, we need to advise the total calorie requirement per day, and a dietitian should calculate the calories per day. Then we advise the diet accordingly. So, and also the composition of the food is most important aspect in management of the diet in obesity. So the 70% of energy should be supplied by a carbohydrate, 20% should be by protein, 10% by unsaturated energy. So that's why the comprehensive management of diet is very important in management of obesity. Next, I'll talk about the exercise. What type of exercise we advise the patient depends on the patient ability to do the exercises. We advise the patient a regular brisk walk, and if the patient is able to do some aerobic exercise, that is also fine. So that's why the exercise is also plays a major role in management of obesity. The most important aspect in the management of obesity is the patient mindset. Patient should get convinced to reduce his weight. This is the most important aspect of management of obesity. If the patient is obese, if the BMI is more than 30, if the patient has diabetes, hypertension, and he failed in management of diet and exercise, then we can consider a surgical management of obesity. That is called bariatric surgeries. So bariatric surgery revolutionized the management of obesity. We have so many restrictive procedures and bypass procedures in management of obesity. Both the restrictive and bypass procedures has less complication and give a good results, and also they reverse diabetes as well.